everybody. Happy Wednesday. Welcome to GCC's Georgia Chiro Connection. I'm your host, Dr. Kathy, and today I am joined with one of our DE brothers out of Fort Worth, Texas, Dr. Chase Dyess. Hey, Doc, how are you?
I'm good. How are you, Kathy?
Doing fantastic. Thanks so much for taking time out of your day to come join us.
You're welcome.
Yep, we greatly appreciate that. So we're going to jump right in because today we're going to be talking a little bit about some of the Parker principles that are infused into not just your practice, but your life. And that's the concept of faith, confidence, and belief. So jump in, talk to us a little bit about this because a lot of our GCC docs, we're life grads. So we really live on that lasting purpose to give, to love, to serve, to do out of our own abundance with no expectation of return. And the Parker principles are very, very similar, but yet a little bit worded differently. So talk to us a little bit about that.
So I'm sure many of you are aware that Dr. Parker and Dr. Sid were good friends and they worked together. And I think Dr. Parker was one of Dr. Sid's mentors back in the day. But faith, confidence, and belief in your product, service, and idea as a chiropractors, in my opinion, is very, very, very important. And the reason for that is, I don't know if you guys noticed, but chiropractic's not the easiest profession to practice. There's a lot of people that have a lot of ideas about medicine, drugs, surgery, and they really try to outshout the true message of chiropractic and how it removes interference and allows the body to heal itself. So having a strong faith, confidence, and belief in what it is you do really helps everyone. It helps the office. It helps your patient. And there's a saying, the most convicted wins. So that's really what I want to talk about today.
I like that you said that because there's a lot of great sayings when it comes to being confident in what you're doing. And Dr. Sid always said, speak with authority. And a lot of people talk about you have to be so strong in your belief that you overcome their doubt. So talk to us a little bit about how do you use this in your practice and how do you set patients up day one where you're really helping them to understand what it is that we do so that they have a greater expectation for their outcome?
So the first thing we do is we listen to them because I think a lot of patients want to be heard. I think a big mistake is going in and pounding patients over the head with chiropractic principle. What we do is we figure out what's going on in their life and what brought them in. And I wish that I could tell you that 90% of the people that came into my office were just like, I heard chiropractic's great and I just really want to be healthy. But majority of the time, the ticket to the show is pain management. And that's not what we specialize in, but we like to figure out what they're there for. And then we transition into functional goals that they want to achieve, things that are really important to them. And a lot of times by the end of that consultation, they've had some light bulb moments where they realize, hey, I can't go out with my spouse anymore without being in pain. I can't play with my grandkids. And then we educate them on the organic issues. My digestion is trash. My sinus and allergies are always acting up. I have no energy. So we initially figure out what's wrong with them and then what are the things that they want to get out of chiropractic care. Because if they're getting what they want out of chiropractic care, and then we come in after that and explain to them what it is we're looking for and how we can help them get that, then the likelihood of them staying and sticking around increases tremendously.
Right. So a little bit of what I hear, and a lot of the doctors that I get to bring on to do this Georgia Chiro Connection with us, the conversation is always about how do we shift patients from pain to something greater, right? How do we go from how do you feel to how you function? How do you shift them from pain to brain, whatever terminology you want to use? And I like that you're using the idea of establishing goals with a patient so that it's essentially it's their own words, it's their own desires, it's what they want to accomplish in your office.
Absolutely. Absolutely. It's all about what they want to get out of care, but they come in with surface level thinking. I just want to be rid of my headaches or my lower back pain. And they never really sit down to think about how that's affecting every area of their life. how it's affecting their focus at work, their interaction with their family, their mood, their energy
Mhm.
levels. And they don't even realize, a lot of them don't even realize how deep it goes. And then we explain to them the life principle, because I'm a DE guy, and we explain to them how to restore life back into the body. So then they're really like, oh man, you can help me more than just with my headaches, my sinuses, my allergies, my energy, my digestion. I mean, it's amazing to me how many people think that things like acid reflux, indigestion, sinus allergies, these are normal things.
Right. And they think it's normal in their kids too.
Yeah.
Well, I had it, my grandmother had it, my uncle had it, so of course my kids are going to have it. And it's that mindset of normalizing the abnormal.
Yeah. That's why we have to be the most convicted, because out there they're being inundated that this is normal. Don't worry about it. It's normal. Just take this pill, this potion, or this lotion.
It's almost, and this is how I say it all the time, it's almost like they're trying to convince people that their bodies are dumb. It's not smart enough. It's not strong enough. It's not healthy enough. You can't produce the right chemicals. You can't heal. And yet we have this, as you said, faith, confidence, and belief, not only in our product, services, and ideas, but in our own innate intelligence. And that confidence that we have in the innate intelligence that animates the living body, we need to be able to communicate that in a way that empowers our patients.
Yeah, innate intelligence is our product. We work with it and we restore with adjustments, So I agree 100%.
So if you're helping your patients on day one to establish goals, what is it that you do in your office that some of our docs listening right now can benefit from to help measure and track those goals to make sure that the patients are not only staying right in alignment for what it is they want, but so that they understand they're getting closer to their goals by being under care?
So we do some objective measures because, as you know, pain is usually the first thing to show. I mean, the first thing to go away, and it's the
Right.
last thing to show up. So when you look at a nerve in the spinal cord, only 20% of it or less controls pain. The rest is function. So we always reevaluate every 30 days, and we look at their motion and their neurology to make sure that their neurology is balancing out and dermatones and their range of motion is being restored. But then we always re-x-ray. One thing we do when they first come in the office is we do motion study x-rays. And the reason I do motion study x-rays is because it shows independent motion of each bone in your spine. So it doesn't take a rocket scientist to say that bone is not moving. I see that on x-ray. It's not working the way it's supposed to. And then we have an adjusting protocol that restores the motion to a joint and takes pressure off the nerves. And when we re-x-ray and there's motion restored to that joint, just because they're not feeling 100% better, or that nerve hasn't had enough time to heal because it's been subluxated for so long. We all know the nervous system takes the longest to heal. We can show them that there's progress. Now, over 90% of our people make outstanding progress in our office and they feel better. But those that don't, we just want proof. The proof is in the pudding, right? We want proof that what we're doing is fixing your problem. This is not just subjective, I feel better. This is the slam dunk for my office that proves the medical profession wrong. Like, if you come into my office and I show you where a bone is stuck, not moving, putting pressure on the nerves, and we implement a plan, and then I re-x-ray you and show you where it's not, you can't argue that.
Right. It becomes indisputable. And it also helps get people out of the pain mindset, right? Because pain, to me, it's a no-win situation because there's only two solutions. There's really two outcomes. If somebody comes in pain and their whole focus is on getting out of pain, then either you get them out of pain and they're gone, or you don't get them out of pain and they're gone, right? And if you stay in that pain model, that's your only options. Either you get them out of pain and they think that's all it is, and I'll see you next time I have pain, or you don't get them out of pain and then they think that chiropractic doesn't work. So transitioning them to a better understanding of function and how the body works and the innate intelligence and the immune system and the nervous system, and making sure that their body can perform, is such a better way of managing not only their care, but helping them to understand why it's essential for their family, their children, their coworkers, their friends to come into the office.
Absolutely.
Yeah. So tell us a little bit about some of the fun stories and the miracle stories that you get to see in your office.
Oh, wow. I don't even really know where to start with that. I didn't think about it, but so.
Do you have one patient story that kind of stands out in the mind that you always want to share?
Well, recently we had a lady that's 65 years of age, and she came in with a severe loss of curve in her cervical spine, like phase 3 degeneration. And she's stuck with care. And after a year of care, her innate intelligence, her body restored her cervical curve to perfect without any help but adjustments, chiropractic adjustments. And she had 42.5 degrees of cervical curve at the age of 65. And that, for that lady, could equal staying out of nursing homes, walkers, right, wheelchairs, dementia, Parkinson's. So that was huge for her. And that's just one of the many cases. I ran into a lady yesterday. This reminds me of one of my old mentors, Dr. Sigafus, but I ran into a lady at a restaurant for lunch the other day, and she was laughing. She said, "Yeah, I tell everyone you got me pregnant." And she came into the office and was struggling having kiddos, and started getting adjusted. And next thing you know, she's pregnant. Then she's one of my neighbors and brings her kid over to get her adjusted when she has her kid. And, that kid's 8 years old now. And it's crazy. And so you guys have all heard the stories. I think the most important thing for chiropractic is specificity. You need to distinguish yourself from a bone cracker. Anyone can go up and down the spine, pop the neck, right, left side up, right side up. Mm-hmm. That does our profession a disservice, because it's all pain-based, it's all generalized, and you want to be specific. You want to have a technique that you believe in, you have faith, confidence, and belief in, and you want to clear out the spine so the body can flow and the nervous system can function at 100%.
I love it. That's fantastic. Now, Dr. Chase, I would be remiss if I did not mention that today is International Women's Day. I see a lot of pictures on the background in your office. So tell us about one or two of the women in your life. I know you just shared some patient stories, but tell us about one or two of the women in your life that need to be celebrated on a regular basis, or deserve to be celebrated.
My wife, number one. I met my wife in chiropractic school over 12 years ago. Her father's a chiropractor. Her uncles are chiropractors. Her grandfather was a chiropractor. We have 4 kids together, 4 boys, and she is just amazing. She's so amazing because she grew up as a chiropractic kid. She's never had vaccines. She doesn't take medicine. I can't tell you how much it makes my life easier and how much it keeps me on the beam to have a woman like that in my life that stands beside me and sometimes in front of me when it comes to living a certain lifestyle and taking care of ourselves and living that chiropractic lifestyle and helping me raise healthy kids. I mean, you wouldn't amount to the amount of laundry that she does on a weekly basis is just ridiculous. So
I can imagine with 4 boys, because I've got a lot with 2 kids. I got a boy and a girl, and it's like 14 loads a week. So
yeah,
I can just imagine what you're going through with 4 boys.
Yeah, so she's amazing. I'd give it all to her, like out of this world. Super amazing. So that's who I'd give a shout out to.
Love it. Love it. Fantastic. Well, I want to thank you for sharing some of your time with us today.
Yeah, you're welcome.
Absolutely. And of course, I have to mention that we have a lot of great events coming up for GCC. You know, we've got Cinco de Cairo coming up in May. We've got the Cornhole Tournament coming up in June. We start our continuing ed programs July, August, September, October, November, and of course, rounding out with our convention in December. So we'll be all over the state doing continuing ed. We've got some philosophy events. Of course, that's your Cinco de Cairo and your cornhole tournament. Those are great opportunities to not just get dipped in the philosophy, but really get together with some other like-minded people, be around chiropractic families, bring your kids, bring your spouses, have a good time. And don't forget, we've got DE coming up in April back down in Sarasota. So mark your calendars for all these things. Of course, the crawl is going along the bottom, and our Chiro Cup coming up October 19th. It's going to be back up here at Bridge Mill again. It was a phenomenal event last year. It's going to be just as phenomenal. We already ordered the weather to be perfect for that day, so don't worry about that. The weather will be perfect as always. Mark your calendar, check out our website, georgiachiropractic.org, and you can get registered for the Chiro Cup there. Don't wait, because it will sell out this year for sure. So I want to thank you, Dr. Chase, for coming on.
You're welcome.
I want to thank everybody for watching us, whether you're watching live or you're watching a replay. We appreciate you, and we look forward to seeing you at one of our upcoming live events or right back here every Wednesday for GCC's Georgia Chiro Connection. Take care, everybody.
Take care.